All right. Well, good evening, everybody, and welcome to the third installment of the SEIU-UHW Coronavirus Weekly Update. Sorry that we're a couple of minutes behind here tonight, but we've been encountering some technical difficulties, and frankly, my sense is that it's just the numbers of people who are now using this sort of technology, whether it's Facebook or Zoom or even the cell phones. And so we just had a problem with getting a solid feed and a solid link established. In any event, I want to welcome people to this. We are going to be spending about the next hour together really talking about what has quickly turned into an unprecedented situation in our country, in our world, and certainly for us as healthcare workers. My name is Dave Reagan. I'm the president of SEIU-UHW, and I'm joined tonight by two of our rank and file leaders, one from Northern California and one from Southern California. And I'd like to start by giving Gabe Montoya an opportunity to introduce himself. So Gabe.
Hi, my name is Gabe Montoya. I work at Kaiser Permanente in Downey in LA County. And I'm also a union-wide executive committee member for SEIU-UHW.
Great, thank you, Gabe. And we also have another guest, a member by the name of Andrea Tuma. And I'm not sure, Andrea might have been a victim of the technical issues we're having. In any event, as we attempt to get her back, Andrea is...
I'm here.
Oh, you're here. Great,
Yes.
Andrea, I'm sorry. So why don't you
okay.
go ahead and introduce yourself? My mistake.
My name is Andrea Tuma. I am an executive member of, or executive committee member also. I work at Dignity Health Mercy Medical Center Reading in the North State, and I'm a registered respiratory therapist.
Great, thank you. And it's great to have both Gabe and Andrea with us tonight. So as we've said in the past few weeks, what we're trying to do here is we want these weekly updates to be an opportunity for not just UHW members, but for people generally, our friends, our families, our neighbors, people we care about, to have an opportunity where they know that they can check in once a week and where they can get some really high quality information. They can get their questions answered, and they can have an opportunity to just hear from each other about what's going on across the state and across our various healthcare facilities. So tonight, a couple of things we're going to do a little bit differently than we've done in the first two sessions. And let me begin by saying that last week in particular, we got so many questions, and we took questions live last week, and we got hundreds and hundreds and hundreds of them, and we're able to answer about 10 or 12. So we're going to change that up a little this week, and later on in this broadcast, we'll be summarizing the questions that we're hearing most frequently from people, so that hopefully we're being as responsive as we can to what's on folks' mind out there across California. The second thing that we're going to do is we really want to just bear down on a single topic tonight. And I think all of us know that we have been contending with the issue of how do we get the proper supplies, the proper personal protective equipment, PPE, so that our members are safe out there doing their jobs and doing what our patients are counting on us to do. And this has been a challenge and a struggle, and it's been such a huge issue that we really want to make that the theme or the focus of what we're going to talk about tonight. So we want to focus on PPE, and in particular the shortage that's going on, and we want to look at it through three different prisms, if you will. What's going on inside of our hospitals? What are we doing to contend with various issues and challenges that are arising in our hospitals? And then the third thing we want to focus on is what are we doing to deal with the broader shortage of getting masks and gowns and face shields and everything that people need. So we're going to make those two adjustments this week, and we're going to try to make this as conversational as we can. And again, we're going to get the information up after this broadcast is done so that people can see on our website, here's just answers to the questions that you care the most about. So what we're going to start with, we're going to, go back to Gabe and Andrea, and we want to begin with just giving them an opportunity to talk about what's going on out there. What's going on in your hospital? What are you seeing? What are you experiencing? How are we working with management? Are we having trouble with them? All of that kind of stuff. So I'm going to start in Southern California with Gabe and just give him an opportunity. I know he's been real active in his department, in his facility, and making sure that he's representing UHW members to his very best. So Gabe, what's happening out there?
So yeah, over here at, I work in the emergency department at Kaiser Downey. And so, I would have to say a lot amongst the members of UHW and even other members of unions outside UHW, there's a lot of fear, right? There's a lot of frustration as, workers, healthcare workers. We can clearly see that the Trump administration, the CDC, the World Health Organization, and even our employer are rarely on the same page. So that creates some confusion and frustration. And so, right now workers are afraid. And so I feel it is my job as a union leader, and our job as a union is to create some sort of security by answering some of the calls for help. And I got to add, the surge that we keep talking about, we're starting to see occur. We went in just a matter of 3 days in the emergency department from having 20 beds of people who had influenza-like illnesses and people under investigation. Went from 20 beds in a matter of 3 days. We've now got 40 beds cohorted. And so that does raise concerns when we talk about PPE shortages. And then on top of that, I know that we want to find out what's going on in the hospitals, but at Kaiser Permanente, we also have clinic workers. And I'm hearing a lot of frustration from clinic workers who are feeling like managers don't see them as frontline workers the same way we tend to see emergency room workers. And so there's a lot of fear. What am I being exposed to as a service rep, right? Sitting at the front desk with someone who comes in and I'm the first person they talk to. And so I think as a leader, I'm trying with the rest of my leaders to really mitigate those issues. The Kaiser's a tough ship to work with because it's so large. And we definitely see an unevenness with the partnership in my department. I'm working great with my leadership here. Outside of these departments, we do have a lot more, outside of my department, we are seeing a lot of challenges.
Great. All right, well, thank you, Gabe. And before we ask Andrea just to give an update from her perspective and what's happening in her facility, I want to remind people who are watching the broadcast to please leave comments, right? And to please, enter your comments. And again, we read every single one of those. We try to collate them and put them together. And then we want to follow up and make sure that we're being responsive in between these broadcasts in trying to address the challenges and the issues that people are raising. So now I'd like to ask Andrea to just give her perspective from the northern part of the state and from her employer, Dignity Health, on what's happening in your facility, Andrea.
So for our facility, our CEO came on the news and told everyone that we were fine with PPE and everything as long as people are being very conservative with it right now. On the other hand, the employees are worried because they would like the comfort of being able to wear a simple mask within the facility right now to keep themselves safe. It makes them feel better, and they are not being afforded that ability. As well as Gabe, we have a lot of small clinics that run on the outside, and they too have the same concern that people are coming into them and they're coming in ill, and they have no protection. People are coming in coughing or refusing to wear masks, and they are within that 3-foot range. And so this is very concerning for them and for their family. There has also been a delay in some of the areas up here as to getting tents and things set up because management wasn't on the same page as in St. Elizabeth's Hospital, thinking that the virus will take time to get here. We still have time to do this. And so the employees are starting to feel that maybe things aren't being done in a timely manner because everyone assumes that since we're a small area that we have time. And so there's a bit of frustration and fear when it comes to those things. So, and then we also have I have another outlier of people at Enloe Medical Center, and the people there are very frustrated. They feel that management doesn't have their best interest in heart right now. They don't want to accept help from the union in trying to procure appropriate PPE and things like that. So there's a bit of frustration going on up here, with the thought that we're far away from where all the danger is, and we probably won't have an issue here, but we've started having people coming in with COVID symptoms and stuff. And so we don't want to wait to prepare when it's too late.
Right. So thank you, Andrea. And I just want to make, one initial observation. As I said at the outset of this is the third installment of this. We did the first one 2 weeks ago, and obviously we did the second one last week, 1 week ago. When we did the first one 2 weeks ago, the coronavirus was still an emerging thing. There were no shelter in place orders. Everything was open. It was starting to puncture people's awareness, but life was going on in a mostly regular way. And in fact, we conducted the session, the broadcast, in groups in our two offices. We had people in Northern California, and then we had, people joining us from offices in some other locations. A week ago, the folks who participated all participated from home. And in the space of that week, now there were significant shelter in place orders, but not everywhere in the state. The whole virus had exploded both in people's consciousness, and we were really starting to see the effect of that. But schools were some open, some not open. And then you fast forward to today, shelter in place everywhere, schools are shut down, beaches are shut down, public places are shut down, and we're seeing many, many more patients than we've seen before who are either positive or could be positive, with the epicenter really being focused around Santa Clara. And I say that because in the space of 2 weeks, the entire world has changed and everything is different. And one of the things that I take away from both Gabe and Andrea's points and what we're experiencing across the union is that the response from our employers is very uneven. In some cases, it's uneven inside of a particular system, and it's also uneven between systems or between employers. Second thing we're hearing over and over is just the level of anxiety, the level of fear, and then the frustration in places like Enloe. And we're going to talk about Enloe later on because they've really earned their place in a list of bad actors that we have across UHW. And one of the things we want to do on these broadcasts is give credit where credit is due, but also point out people who are just not being responsible, not being respectful, and not doing what they ought to do. So with that, recognizing that we're navigating a constantly shifting landscape, rapidly changing, unevenness, I'd like to also ask Gabe and Andrea just to talk in some concrete and specific ways about how we've addressed challenges in your facility and with your employer, and try to give a sense of what we've accomplished and what we've been taking on in the last week. So Gabe, we'll start with you at Kaiser.
So yeah, just a couple of days ago, Kaiser was basically telling members they couldn't wear a simple mask in the hospital, in the ER. And they were basically saying, well, you can't wear a simple mask, you can't bring your own mask in. And that created a lot of fear and anxiety. It got to the point where people were being told if they had a mask on already to take it off and throw it away, which to me made no sense. If we're on a PPE shortage, why are we throwing anything away? And so, it was starting to come, I had sent an email to the leadership team here at Downey, and I said, look, people are gonna become afraid and they're gonna start not showing up to work because they need to go home to their families and not worry about giving this to their loved ones. Sure enough, we saw a spike in just one day of sick calls. And then, we did have conversations as an executive committee with the CEO of Kaiser Greg Adams. And I think we, like Dave, you went in a circle and you said, I want everybody to express to him what they're seeing on the ground. And we did that. And I think that made an impact because we really needed to show him, like, look, there's a lot of fear out there, and workers have a hard time coming to work and doing their job when they're afraid that they can take this home to their family. And most of us aren't even worried about getting sick ourselves. We're worried about what we can do to our families when we get home, right? And so now the policy has changed. If you have a mask of your own, you can bring it to work and wear it. If you don't, and you want to put on a simple mask, if that makes you feel comfortable, put on a simple mask. I do always caution my members in my department to make sure we're not being wasteful and that we're trying to stretch that out, right? Because when the surge hits, I still want them to be safe. But I will say that even with that, I'm still hearing from members in clinics who are still not being allowed to wear masks or being told to take them off if they have them, and are not being allowed to bring masks from home. I mean, I just got text messages from Whittier Clinic just yesterday with that issue here in Whittier, California. Pardon me, and I did that wrong. And so, we are putting pressure on management. I could speak for myself when I say I've come into huddles on my days off because I need to let management know that I'm here and I'm listening to my members. We're, as of yesterday, we decided we're gonna make sure that someone's in incident command from our union, whether we're invited or not. We're gonna be there because we got to give voice to our workers and really hold the organization accountable. That doesn't mean we're ignorant about the fact that there is a finite amount of PPE, but we also know that as workers, our contract is still in force and we still have a right to work in a safe environment. And like I've told my members in my department quite bluntly, if you're told to go into some area or population of members and you're not given the correct PPE, it's a simple no, because our lives matter, right? The health worker is not expendable to anybody.
No, and I just want to add and extend something you said, Gabe, and I want to share with the whole group. Gabe and I talked 4 or 5 days ago, and Gabe was telling me the story of in his facility, and I think it was in your department, where the doctors were totally suited up with every bit of protective equipment, way beyond what they were saying was necessary in general terms. And then there were also situations going on where at the same time, physicians who were fully decked out in PPE were telling our members in UHW and other members in the facility that they didn't need an N95 mask or that they didn't need the stuff that they themselves were wearing. And I remember saying to Gabe, I was so upset by that. And as he said, we got a hold of the CEO of Kaiser Permanente, and we had our 12 members of the executive committee from the Kaiser division do a conference call earlier this week. Every single person, got very real with Greg about what's going on across the system. And I do think in the space of the last week, to what Gabe was saying, last week we took on this issue of the physical security and the traffic flows just inside, coming in and out of the facilities. And it's totally different this week. A very limited number of entrances and exits, right. Greeters at them. This week, we're making sure that all of the greeters have full PPE, and we're not just putting people out there. And beginning tomorrow, we're going to start doing temperature checks at the Kaiser facilities across the state. And so even though we're seeing unevenness, even though we're seeing examples where people aren't following the policy, Kaiser is moving every week steadily towards a different place. We are struggling with them. It's not pretty everywhere, but I think we're making headway. And I want to appreciate, Gabe and our other member leaders who, keep bringing these issues to our attention. And I would, the issue about being able to wear your own mask, the physical perimeters and entrances and exits, and now being included in the command centers, which wasn't happening a week ago, but we're now saying, look, if we're in this partnership, we got to be partners, and our union leaders need to be there in your command centers to make sure that we're all working these issues in real time. So I just want to appreciate Gabe's leadership and others in the Kaiser division. But I can certainly see, if you think about these broadcasts every week as a marker in time, that each week there are some very different things that are taking place. So,
And can I just
go
add
ahead.
something, Dave?
Yep, go ahead.
You know, to the members that are listening to this, let me just make it clear: you do not have to be an elected leader in this organization to be a leader in your department. We all have the right, and in some way the obligation, to hold management accountable when they are not following the protocols that are being put out there, and when they're ignoring parts of our contract. Yes, this is an emergent situation, but that doesn't mean that we ignore the contract. And I encourage you all to be leaders, stand firm. And if you need backup, you reach out to us. We are doing our best to support our members as leaders.
Great. All right, Andrea, how about you and what's happening in your facility and in Dignity?
Up here in the North State, so what started out, as far as the face masks go, I have had numerous, and I mean, plagued by lots and lots of phone calls of people complaining that they are not allowed to wear simple masks within the hallways. They are not allowed to wear them anywhere in the facility, as well as in the clinics where they are the patient representative. When the patients first present, they are not allowed to wear masks there either. And it has been a hard push going forward. Management's position has been that if we don't conserve PPE now, we won't have it for you later if there's a surge. And then the second portion of that is that they think that the mask should be put on the patient. If the patient is coughing, then the patient needs to wear the mask, not you as the employee. And I am finding that overall, the staff is afraid. The staff is afraid to come to work, that they will be bringing something home to their family, that they will be bringing something home to their elder parents, who they're the only ones that care for them. It's fear. And one of the people that I know said to me that it just gives them some comfort knowing that at least they can put something over their face to remind them not to touch their face, and remind them that they need to be more careful. And yes, they're washing their hands more often. Our facilities up here have gone to stringent entrances and exits. They have screening areas up here. They're doing a really good job of that. In fact, we actually have tents out. The nurses in there are wearing N95s that do the initial screening and making sure that those kind of things are happening for them. That part of it is done well. But I really feel for our clinics. They are just now in the midst of all of this getting fit tested for their N95 masks, and they've been seeing people that have had influenza type things and having to be in the rooms with them being swabbed. So those kind of things, they're happening, and they're happening a little bit slower than I would like for them to be happening, and the members would like them to be happening. So there is an underlying fear, and as someone else said to me, once you tell me that I can't or that I shouldn't, it makes me wonder why. It makes me wonder what you're keeping from me. And I immediately want to run out and grab every single mask that I can get my hand on and just keep it for myself, knowing that this is the only thing that could possibly protect me. And so just trying to remain calm in a very unknown situation at this point in time and try and help give our leaders voices.
Right. Andrea, can you say a word, like, on the one hand, again, imperfect, but we've been making some progress. We've dealt with issues around entrances and exits and, working through the PPE issue. Can you please speak about what we've experienced with Enlo, in the past week, and just because it's important that, this is an incredibly serious thing. And I think we have to make these broadcasts a place too, where if there are particularly bad actors, we need to talk about it. We need to, assure everybody that we're going to be following up and doing something. So what do you have to say about Enlo?
I'm so disappointed in Enlo right now at this point in time. The union was great at helping us procure masks for our members. Dignity Health stepped up and was like, yes, we want to protect, our employees. We want that. And then when it was set out to Enlo, the first thing was, well, how much is it going to be? And then the next thing was, well, we don't really need that. It's just too expensive. We don't find it necessary. We'll take care of it ourselves. And then complete and total shutdown. There is a complete and total disregard for any help. There is no collaboration. There's a lot of hostility, and the members feel that. The members feel disrespected, they feel devalued, and it is just not a good place for them to be right now. They don't feel that Enloe has their family and their employees' best interest at heart. And so this is a huge fear part for these employees. And I really feel for all of them right now, and trying to do the best that I can. Being their e-com is, the best that I can do, and trying to reach out and help them. But they really aren't interacting with us. They don't want any help, and they don't want to be involved in any portion of trying to let us help them get their members protected.
No, and I just want to say to, any Enloe members that may be watching, or if you're working in a hospital where you're just getting stonewalled and, given the runaround, we want to hear about that. The Enloe CEO went so far as to put out a written statement in the last day or two that is just totally ignorant, totally disrespectful. We are not going to stand for it. We are going to follow up. We are going to deal with that institution and that individual at the corporate level, at the facility level, in every way that we can. And again, this just this cavalier attitude about the physical safety of people was just so far out of bounds, and we felt it was so far out of bounds. We wanted to make sure that we highlighted that tonight and said a word about it. So that really leads us into, and Andrea alluded to it, and I know Gabe has been working on it, and I know that people up and down the state have been getting creative and reaching out through their networks and everything else. But we want to take a couple of minutes to really talk about what we are doing in every way possible to address the issue of the shortage of PPE. And Gabe said something before that I think is right. We are mindful that the shortage is real. And for those that didn't know it, 80% of PPE supplies in the United States come from China. And when China got under siege with the coronavirus and they shut down all of their manufacturing, that has a ripple effect. And then it slows and then ultimately stops the flow of medical supplies to the United States. And so we have less inventory, we have less of a cushion, and now we're starting to deal with the effects of the virus. So having said, though, that it's real doesn't mean that we can't do anything about it. Doesn't mean we shouldn't do anything about it. And so, I know Gabe was involved in a local effort in his facility. And Andrea, I don't know if you're aware of local efforts, but I'll give you a moment to say that. And then I want to talk about what's going on across the union as a whole, because I actually think we've made a lot of progress, and I want to give a good report to people about this.
Well, I personally have been one of the people trying, as being a respiratory therapist, I found it was really important to make sure that my fellow brothers and sisters had appropriate PPE. And so N95s being one of the things that most of our therapists will need and have to use. I reached out to a couple of companies that I know, Johns Manville. I reached out to them, and I have not heard back yet if they have anything that we can donate. But Knopf Insulation Industries up here in Shasta Lake has donated, today they donated a case of their N95 masks. I also reached out to a lot of the tattoo parlors and the eyebrow ladies and eyelash ladies, people who aren't working right now, to ask if we could have their stock of gloves, and we could have their stock of even simple masks or anything else that they can donate. And I'm just trying to branch out and think of any place, any crevice, any corner to find anything, so that way we can make sure that our frontline healthcare workers are protected right now at this time. So I was really happy today for Knopf Industries to, insulation, to donate that, and it made me very proud of the area that I'm at.
Great. And I've heard examples up and down the state of people reaching out in their local communities and people doing exactly that, having 50 or 100 or 25 of this or that. And there's been tremendous support and a tremendous response. I want to take a moment and, particularly, again, thinking about it, that in the last 2 weeks, how everything's gotten turned inside out, we really came away from the discussion last week, like, we got to do every last thing we can think of to figure out how to find supply of masks, of face shields, of other kinds of PPE. You know, we need more of everything, and we need it yesterday. So I'm really happy to be able to report to people tonight that in the last few days, we have made tremendous gains and tremendous progress in UHW, and particularly in the area of masks and face shields, of securing, you know, very large volumes of supply. And I just want to take a second to lay this out for you. And really starting about 5 days ago, we just started making phone calls. You know, I've never done, you know, supply procurement. Lots of other people in the union have never done it. We all just got on the phones. And as of today, and in fact, today we confirmed a list of, you know, our employers and others, and I'll give you the particulars, but we've managed to find and secure, and we've begun the purchase and the transport of 39 million N95 masks to bring into California and other places to get into the hands of Andrea and Gabe and all of you out there doing this work. 39 million masks. As of today, as of right now, Kaiser will be the recipient of 6 million of those. Dignity will be the recipient of 5 million of those. Sutter today got their request confirmed for 2 million. The Stanford Medical Center, 500,000. John Muir in Northern California, 500,000. And I have to also say there were a bunch of employers we reached out to that either didn't respond to us or they said no. And on that list includes Providence Health in Southern California, AHMC, Cedars-Sinai, and others. You know, they're not alone, but, you know, we've had, on the one hand, we've had tremendous reaction and enthusiasm. And on the other hand, we've got some folks who seem to be working from the Enloe playbook. And what we were saying to them is we have 39 million masks. They're $5 a piece, which is what these things cost these days. And we can have them shipped to you and they can be at your facility next week. And so to their credit, Kaiser, Dignity, Sutter, Stanford, John Muir, and some others, you know, jumped on it. They're doing it, and that's going to happen. I want to report to people that we also succeeded in getting 3 million of those masks sent to New York City and the hospitals there, because they are right now at ground zero. That, I don't mean that to be the wrong sort of analogy. I'm sorry about that, but they're coping with something that's really, really difficult. We wanted to help them out. Today, the state of California, the Office of Emergency Services took 1/3 of the 39 million masks so that they can distribute them to healthcare workers across the state in all sorts of settings. So even if their employers aren't being responsive, the state was responsive and they took 13 million. And we're now working hard to secure other supply. And we are, as crazy as this sounds, we're talking to manufacturers in China. And we're hopeful that by this time next week, we will have unlocked another production line of 20 million N95 masks being produced a week that can come right here to California to make sure that healthcare workers on the front line. So I'm really proud, and I appreciate the leadership across the union that through our efforts, we've identified almost 40,000 of these masks, or 40 million, excuse me. And we're going to find millions more. The other thing I want to report to people is that today we also confirmed orders for almost 3 million face shields, protective face shields, mostly, you know, in same list of employers, people who want them and who are willing to work with us. We're getting it to them as quickly as possible. And so I can say honestly that if you look at the employers who have worked with us to do this, it's employers representing about 85% of UHW members have worked with us on this. Because when you take Kaiser, when you take Dignity, when you take Sutter, And, the others that I mentioned, you're getting up into the 80 to 85% range in terms of the total membership of the union. Unfortunately, there's still 15 to 20% that aren't where they need to be, and that's our work going forward. The final thing I want to say about this is you all know that PPE is not just masks and it's not just, face shields, but we thought masks were the most important thing and we wanted to start there. But we're also now talking to manufacturers, mostly domestic US manufacturers who produce textiles and who produce other sorts of goods that they convert their production facilities to produce medical supplies, gowns, ISO gowns, scrubs, other types of, protective gear, headwear, the booties that go on your shoes, all that kind of stuff. And one of the things that's very clear to everybody is it's just a real issue that the United States, when this thing happens, we don't have an independent supply of critical medical goods for our workforce, and people are at risk, and patients end up being at risk. And so we're trying to make the case with our employers, with elected leaders, and ultimately with the federal government that this really is an issue of national security. And we can't in the future be in a situation where, we have to be on the phone, to people that we've, never seen, never met, never knew about, trying to, find this stuff, in real time at times like this. So I wanted to report all of that. We're going to continue to, be doing this and to pursuing, getting supplies everywhere we can. And, I really do think we're going to start to see a large influx. And then the very last point I'll make about this, last week we were at a critical level where we were in danger of not having, virtually any supply in some places. And through a lot of different efforts in the past week, we've now got a little bit of a cushion. The state of California is on it. And people should know that we have a goal, everyone in California, of finding 500 million masks. So our initial contribution to that was 40 million, and hopefully we'll be adding 20 million a week going forward, but that's just from our organization. And I hope, that people see the results of that. So with that, as I mentioned earlier, we're not going to take live questions because we get so many, and we want to make sure that what we're talking about is reflective of what people are, saying in large volumes. So I'm going to ask our moderator to, to just try to begin with, what are some of the most frequently asked questions that we're hearing about, and, stuff that's come in from folks in the past 7 days that's on everybody's mind. So, moderator.
All right. Well, good evening, everyone. Again, as Dave just mentioned, we have been collecting questions that you've been putting in Facebook Live events previously over the course of the past week. And so we've compiled these together for Dave, Andrea, and Gabe to be able to respond to, and hopefully this will be of value for everyone. So the first question is a combination coming from Julie Sante, Charles Vanskoy, and Angie Smith. And basically what they raise, they say this: the lack of PPE and protective protocols makes me feel unsafe. What can we do? What is my obligation to continue to work if the conditions are not safe?
Andrea, do you, as a respiratory therapist, do you want to go first, and then I'll take a crack at it?
Sure. So for the lack of PPE and protective protocols, the one thing that I would say that has happened is we found that the CDC, one of the first things that they did was relax some of our guidelines. One of the most important ones would have been, if you didn't get your flu immunization or vaccine, that you normally would have to wear a mask until flu season was over. That has been relaxed, and now people are not having to wear those protective masks. But those kind of things make me myself feel unsafe, because that rule wasn't changed for our benefit. That wasn't to protect us as healthcare workers. That was changed because they were worried about the lack of PPE that would be available to all the staff and to the nation at large. So what I would say is the one thing that I tell people, and I cannot stress it enough, first of all, you need to wash your hands all the time. You need to keep that social distancing when you can. So if you're in a workspace where you feel that people are able to encroach into that 6-foot area or 3-foot area, then yes, by all means, have the person coming into you, put the face mask on, because if they cough or anything like that, they won't be coughing all over your desk area and things like that. You're going to want to make sure that you try and keep at least that 3-foot separation from them, but washing your hands, don't touch I cannot stress it enough. Do not touch your face when you're at your desk. Do not touch your face when you've touched doorknobs, and make sure that you use the soap and water, and be vigorous about it, be diligent about it, and make sure that you get those things done. And then I saw something at a Kaiser that I was actually very impressed with. They had a little bell that would go off and every hour, and people would stop what they were doing and they would clean. Not just one person, not just like almost every nurse, every person that was around, and wipe off some high touch off. If you are in an office and you want to set a timer and wipe those areas and things like that, some of those things may help ease it. But when it comes to the PPE, if you can make sure your patients that are coughing are wearing them, that's great. If you don't have that availability and you feel that the mask is going to be the only thing that protects you, wear it. Do not put yourself and your family's self at risk.
Yeah. Gabe, are you there? I'm not sure if Gabe had to step away. There he is.
If you
So
guys
Gabe,
I don't know if you guys can hear me.
we can hear you, and I apologize because it's my own technical difficulty, but I think it'd be good because you alluded to this before about, that you don't have to put yourself at unnecessary risk. And I'd appreciate if you would respond, what can our members do? Where should they draw the line? And what can we all do? You might want to share the story just about acquiring PPE that you did, just at your own facility in Downey.
So yeah, when it comes to PPE, it's a touchy. I'm sorry. If you guys can't hear me, let me know, because I'm using Kaiser internet, so it tends not to be that reliable.
You're doing good, Gabe.
Okay. So I think one of the things that we have to do is we really have to, for one, in my department, I work in emergency services, and it really took us collectively working together as members to really put, and this meant not just UHW members, right? It really came to a head when UHW members and UNAC members came together, right? And literally said, like, enough is enough. We're done feeling afraid to come to work, and we're not going to put up with this anymore. And let me start out by saying that for the most part, the director of emergency services over here, Donovan, he's actually been really good in working with us. But on that subject, it's been rough. And I think when the department leadership and the Downey leadership really started seeing that we were not going to let this go, we were willing to say no to certain situations that we felt we were at risk. There had to be a change. And collectively, we said no. We were literally saying, these are situations that we are not going to go into if we don't have the PPE that we think is sufficient. And I'll give an example. We had patients were coming in, and you would have patients coming in presenting with a certain symptoms that were unrelated to COVID. And then while they're here, they start revealing that they do actually have COVID-related symptoms. So you had workers that were going in and out of rooms for hours with these patients, and then to find out, 2-3 hours in, this patient's actually a person under investigation. And that's when we as workers had to literally come together and say, absolutely not. This is unacceptable. And I know that this is uncharted territory for many members out there, right? They think the union's this institutional building located somewhere else. This is really that hard lesson where you're going to have to be tough. If you have to come together in the break room and say, this is the conversation we're going to have together with management, do it. And I always tell workers, there's nothing in this building that should force you to have to put your life at risk. And if you know better, then you need to hold management accountable. And that means if you have to get together as a group and say, this is the question we're going to pose to management, then do that. And it worked, because today, everybody in this building who wants a mask is getting a mask, right? Because we need to be able to feel safe.
Right. No, and I think, Gabe, and I want all of our members and our member leaders to really feel confident that, we're not just complaining, we're not just, arguing about PPE. At the same time that we're, fighting for what's right and standing up for what's right, the union as a whole is also helping employers who want to be helped to get the supplies they need. And part of the reason why everybody's going to get the mask that wants it, it's because we're attacking the problem from both ends, right? We're attacking it at the front line, and we're also attacking it from, the organization as a whole. And I want our members to be confident, particularly if you're at a place where, where management has worked with us, but if you're at a place where they haven't, part of it, it's not just the day-to-day thing, it's also, demand a meeting with the CEO. Why aren't you working to get a bigger supply of this stuff? And it's not just masks, it's face shields, it's scrubs, it's ISO gowns. We have to be coming at this from both directions. And so back to the original question, no UHW member, no healthcare worker, should be put in the position of compromising their health, and in a very, very serious way. And especially when there are others, including physicians in many cases, who say, well, what's apparently appropriate for me is not necessarily, appropriate for you. And I think we need to argue about that one everywhere, all the time.
Can I just say, we actually had to have the conversation as workers. We did collectively. And we had to have a conversation with the physicians at our huddles and say, look, it is unacceptable for you to tell me I can't wear simple masks, and you look like you're about to go and examine ET, right? In his own home. Like, you've got the whole spacesuit on, and you're asking us to go in and care for patients with nothing on our faces. And it was tough conversations for a lot of our members, because they're used to seeing doctors and managers as the buck stops here, the end all be all, right? But you can't accept that under this case. And let me just make it clear, there were supervisors who also weren't allowed to wear masks, who, when we spoke up as workers, were relieved, because then they were able to now wear a mask also, because they were afraid they were going to take this home to their families. So I guarantee you there is power in the numbers, and we really need to hold management accountable. And I really urge all our members out there to understand that you do have a large amount of union members and staff backing you up. And I want to acknowledge the political staff at SEIU-UHW through their efforts of working with the trades unions, with the LA Federation of Labor, has been able to get donations to hospitals. Yesterday, I brought in 60 N95 masks to Kaiser Downey that we got from Solly Miller Construction Company. And that was done by reaching out to the trades unions. So members, we are doing work to make sure that you guys are getting what you need. We are reaching out to other elected officials to help us garner that stuff. Your voices are not falling on deaf ears. And even though it may seem like it's moving slowly, Dave, the CEOs of some of our facilities, and us as leaders are working hard to make sure you have the PPE that you need.
We are all on the hustle.
Yeah,
yes,
Andrea,
we are.
I know you were trying to get in, and so please lend your thoughts to that, because you have strong feelings also.
When it comes to protecting yourself, you have to do what's best for you and to make sure that you are covered, because you know what, if you get sick, then you're not going to be there for that patient's family member that's sick, or that patient that needs you. You cannot take care of these people when you are ill yourself. You need to do what you need to do to protect yourself and to keep yourself safe. And you should not be bullied into feeling that your life is any less, or that your health is any less than anyone else's.
So moderator, I was hoping we could just, a little bit about telecommuting perhaps, but the next set of questions. I know PPE is a hot topic, but in the few minutes we have left, is there anything else that we want to touch on?
Yeah, certainly. So on telecommuting, we had a question from Adelaida Perez Campos, who says, like me, many sit at a desk and make phone calls daily, but have no option to work from home. Are you working on getting us to be able to work at home safely?
Yeah. And does the person with the question identify where she works?
No, she doesn't.
Okay. So let me just give, this is incredibly important, and the same kind of metaphor, the same analogy applies, that if you look at where we were 2 weeks ago, 1 week ago, and today, it's a very different thing. Our largest employer, Kaiser, we have struggled with them about, getting people to be able to telecommute whose work can be done that way. I'm pleased to report that we are now approaching 60% of call center workers in Southern California who are working from home. And in 2 days, we'll be at 67%, and we'll be able to get it up a little bit higher. Northern California has been slower, and we're fighting with them, but we're going to get it to the same levels. And across, all of our employers, I want to give a lot of credit to our Kaiser Division Director, Vicki Jackson, our stewards, our executive committee members, and our other leaders, because this is a daily thing. And I also want to give credit to Kaiser that they didn't dig their feet in. We might have hit resistance in some places, but now we are getting literally thousands of people who are able to work, not fast enough, not all at once, not evenly, but we're making a lot of headway. And this is one where we need to give credit to Southern California. So are we working on it? We're absolutely working on it. And we're going to continue to work on it. And these are conversations that, executive board members have to be involved with the leadership of either their facility or their system. And we are working these guys every day to try to arrive at, different sorts of agreements and different sorts of boundaries. So we made a lot of progress in some places. We got a lot more to make. But I do think, just like every week, first it was the physical security of the buildings and traffic in and out. Then it was PPE. I think we're starting to get on top of that. And now this issue of telecommuting, and other sorts of, work arrangement issues, I think is going to emerge in the coming week. But again, for Andrea and Gabe, if you'd like to, give your perspective on this.
Well, for me, I think I'm going to have to call out the bad actors that we have up here, which would be Optum 360. Thanks for making sure that all of your non-union employees got to work from home, but you left all our union employees working in the facilities, and you can't seem to find the time to help get them to work from home, especially our coders who their work can be done from home. And to tell me that it's VPN, well, you seem to get the licensing for all of those people that are non-union. I find it suspicious. So let's work together and try and get some people who don't have to be there. I have a couple of coders who have immunosuppressed children who don't need to be going into the facility. And I find it wrong that they can't get those people moved out of there and let them work from home. It's just wrong, and it's not right, especially when you have half of these leadership people working from home. It's wrong.
And this is one I want to encourage people to, in your comments, it's a constant battle here. And, a lot of these situations we may be aware of, some of them we may not be aware as we need to. So please make sure there's a good line of communication. And this is the kind of stuff that our rank and file leadership and our staff leadership, we really have to troubleshoot this. And this is an ongoing thing. And just a reminder that this is going to be several months of life like this. This is not going to be over in the next 30 days. And so there's still a lot of incentive to get this stuff done. And I want to encourage people, to be assertive, to be aggressive, and really help us figure this out. Gabe, how about you on this question?
So, we did have an executive board meeting just yesterday for the people here in Southern California. And I know that the leadership, I know members that a lot of times it may seem like, where's the union? Is the union doing the work? It is slow progress, like Dave said, but we are doing the work to make sure that if you can work from home, you're working from home. I know the leadership team the executive board over in Orange County, the team that Denise Alice leads, they're pushing hard to get their communications department workers home. And the reality is that Kaiser can afford and does have the ability and the infrastructure to get people at home. But we do have to be diligent in holding them accountable to that and getting those workers at home. Because let me tell you something, no matter how indispensable as a worker you may feel, Kaiser needs us. And Kaiser needs us to be healthy in order to function. And if that means workers that can be at home working from home so they can stay healthy, they need to do that. And we're going to hold them accountable. And yes, I do give credit to Kaiser for the amount of members we've gotten there, but we're going to keep pushing both for workers that work at regional offices and workers that work in communications. That was one of the big topics at our Southern California Executive Board meeting, because we wanted to make sure that the voices aren't falling silent on those workers who do need to be home in order to stay healthy.
Right. And I think that's right. Nobody's saying that we don't have a lot more progress to make. And I also just want to, take up, Andrea's point that we need some special attention to Optum 360 and the dignity system. So, moderator, do we have time for one more, or should we be wrapping this up?
Sure, Dave. So, combination comments from Christine Ramirez and Brina Martinson, who just raising the issue that managers, of course, have locked up for PPE is locked up in file cabinets, et cetera. And Brina's raises, how will we know if our hospitals have the new masks? And what can we do to ensure that we can get to them once they're now being delivered?
So what we can do from the UHW perspective is, because we've helped facilitate this, we will know when the deliveries are made. And so we can report that, the first 1 million, the first 2 million, was, delivered and accepted by Dignity, by Sutter, by Stanford, by Kaiser, on certain dates. So I think we have the ability to communicate with people and to inform our members that, that the shipment was received. And this is one where if you're at Dignity and Kaiser are obviously statewide and huge systems. Someplace like Stanford or John Muir, those are, they're big hospitals, but they're in one place. And so I think the first thing is we can do that. The second thing is I would encourage us at all the different levels that we operate on to engage management. Maybe they know it's coming, maybe they don't know it's coming. How are they going to allocate it internally? I think those are all discussions we ought to have. So I think from the part of UHW as a whole, that we can certainly, keep people informed as to when the shipments are going to arrive. And then once that happens, I think, well, even before that happens, we should be engaging the local leadership about, if you're in a big system, what's your understanding? What is the day, how many days supply do we have on hand of N95 masks, of face shields? Those are questions that should be asked. And those are questions that the leadership at your facility has the answers to. They know if you have 20 days supply or 30 days supply or 40 days or 10 days, and I think we can do that. So those are just a couple of thoughts. Gabe and Andrea may have others, but that's where I would start.
Yeah, I think here at Downey, the leadership at Downey, we made it clear from the very beginning that we needed to know what our as labor partners, we needed to know what it looked like as far as PPE, and we needed honesty. You need to be honest with the workers, and I think the workers of our union need to remind management that PPEs that are locked up is not about denying to workers. It's about securing PPE for workers. And there's a difference in how we should approach that. So workers shouldn't be made to feel like this is our hoard and we're locking it up from you. No, we need to make sure that we're protecting it, but we're also using it when it's necessary. And I reach out to all the leaders that may be listening to this. It's time to put pressure on your managers and on your local leaders, like Dave said, and say, hey, we need to be looped in on what this PPE looks like, and we need you to be honest with the workers, the workforce, and what this looks like. Because if we don't have trust and honesty, that's when you're going to have the high volume of call-ins and sick calls, because people aren't going to trust that you're taking care of them.
I agree. We have the issue up here. As soon as PPE got locked up, people immediately, one of the first things, like I said, someone said to me was, it makes me want to go take it. What do they know that I don't know? Why
Right.
are they keeping this from me? And as a respiratory therapist, if I come and I'm looking for an N95 or I'm looking for a PEPR, if I have to go and ask it and then have to give a full relegated, this is what I need it for, this is what I'm going to use it for, it makes me wonder, they hired me as a professional. You need to let me use the equipment that I need to do my job the way that I've been told in years past how I should be doing it. If I'm getting ready to intubate someone, I need to have that PAPR on. If I'm doing, you know, in the room when I'm doing nebulizers. So the one thing that I can say that at Mercy up here in Reading, it's not just the PAPRs that we do have those as well, but the respiratory department worked really hard at fashioning nebulizers that have extra filters on them and things like that to protect. And that does help some, but locking up the PPE and asking people exactly what they need it for, it only creates fear, and fear will create a bunch of theft, I guess you could say. I'm not sure, but it will cause people to do things that they wouldn't normally do.
Right. So just one final comment before we close about PPE. And we've talked a lot about what we can do as frontline caregivers, what we can do as a union, what we can do in the context of our state. And I don't want to leave this discussion without saying, you know, this is a nationwide and global issue, and we all have to continue to raise Cain, because the federal government is not mobilizing resources, state governments. It is really a debacle, the way that this is getting handled, everything from mixed messages to ignoring the science. And so at the same time, you know, Gabe mentioned our political work and our political staff earlier. You know, we have to continue to demand from the federal government that they treat this like the most significant public health crisis in the history of the country, which is what it is. This is not some run-of-the-mill episodic thing. This is the most significant public health crisis we've ever had in this country, and certainly that we've had in the world in quite some time, and we have to treat it like that. So I just want to thank, you know, oh, and I should also say, as we go forward, I want to encourage people to go to the union's website, www.SEIU-UHW.org. We're going to post comments. We're going to post information based on what we heard from people. We will do this again next week, and we'll continue to do this for as long as we're dealing with the coronavirus crisis. I want to thank Gabe Montoya and Andrea Tuma for everything they're doing day to day, and for joining us here tonight. Did you want to?
Yeah, I can't leave this call without saying this. To our brothers and sisters out there, do not let EVS workers be an afterthought. We need to band together and make sure that management is allowing EVS workers to have the PPE they need to clean this room. They tend to be marginalized in almost all facilities, and we need to make sure our EVS workers have the PPE.
Absolutely, absolutely, and that, you know, very well said by Gabe, and I know we share that across the whole organization. So be safe the next week. We will check in again with you on next Wednesday. We will continue to work the PPE issue and these emerging issues around telecommuting and other workforce arrangements. Be safe out there, everybody. The only way we get through this as a state and a country is if we have a healthcare workforce that is protected, that is safe, and that's able to do the jobs that you've been trained to do. So thank you for everything you're doing, and we'll see you next week. So good night.